So globally, in terms of cases, we're at 72,377,000 with 1.6 million deaths. Our cases in the U.S. are 16,258,000. The U.S. leads the world globally in cases, followed by India and Brazil. In terms of mortality, the U.S. also has the highest number of deaths reported to date, followed by Brazil at 181,402, and then India at 143,355. The number of deaths to date in the U.S. are 299,193. In the state of Alabama to date, we have 295,631 COVID cases with 4,102 deaths. Here in Mobile County, through yesterday, we tracked 22,411 COVID-19 cases. That's up 132 from Saturday. Our numbers for Saturday were 137, and Friday we had 114. I do want to remind everyone that we do tend to have fewer cases over the weekends, and so often you'll see a bigger number there tomorrow as some of the laboratories catch up. In terms of hospitalizations, our cumulative hospitalizations are at 2,859. This was up 12 in the last 24 hours, and we're at 392 deaths with no increase. Our current hospitalized is at 140. Now, in terms of our number of cases, our number of deaths, our number of hospitalizations, we are seeing increases compared to the last few weeks. If we look at our cases and the numbers that are currently hospitalized, we are seeing the highest numbers reported to date since the spikes that we observed in late July and early August. Our percent positivity from our expanded report today is at 9%. This is not by far the highest number that we have reported, but it is the number of percent positives that we were observing shortly before the July spikes. I do want to remind everyone that 9% is a biased number because it's based strictly on our PCR test and does not include the probable cases that we will receive from antigen tests that are typically conducted at our urgent care facilities. Some of the urgent cares that do report to us are reporting anywhere from 12 to over 20% with respect to their COVID-19 positivity rates. So we've had some questions in terms of, are we seeing this spike due to the Thanksgiving holidays? So if we look at the date of the Thanksgiving holiday and the days shortly prior to that, and then look at the numbers last week and then into this week, you can definitely attribute the number of cases that we're seeing to the events of Thanksgiving week. We've also seen the increase in our schools. So if we look at our school data, and we don't print actually this graph, but this graph essentially reports on the number of school reports that are submitted to Alabama Department of Public Health. So you can see at the beginning of the school year, there was this baseline increase. As you see the dips here in the curve, these are associated with the two hurricanes that we had over the school year. So these were kind of naturally occurring quarantine periods for the schools, and we did have these decreases. But if you look here, you can see that we were already on an increase with the school cases as we were getting into the Thanksgiving week. And then you see the dramatic increase here in the last 2 weeks following the Thanksgiving break. The other thing that we have been watching with respect to the Thanksgiving holidays is the number of homes that have more than one reported case. So we were doing this to specifically look at families who may have been getting together for the Thanksgiving holiday and wanted to assess whether there would be an increase in multiple cases within the same household. So our analyses showed that for the week beginning 11/22, there were 22 households that had more than one case, and we had 46 individuals that were split in those 22 households. So 46 individuals were in households with at least one additional COVID-19 case. If we look at the numbers from last week and then the week that we just completed, there were 52 households with more than one case beginning the week of 29. And for this week, so from 11/6 to 12/12, that number went up to 106 households. So we've increased from 22 to 106 households with more than one case. And this accounted for 225 individuals living in a home with at least one additional COVID case. So if you look at those numbers and look at all the other numbers around that, it's a strong indicator that the Thanksgiving holidays were a driver for an additional increase above and beyond the spike that we saw going into the Thanksgiving holiday. This is particularly concerning for us because as we go into the end of the year holidays for Hanukkah, for Christmas, for Kwanzaa, and then even into the New Year celebrations, we're going to have more parties, additional events that are not necessarily at the city level or metro levels, but these are individual parties. And it's clear to us that these family gatherings are contributing to the rise in COVID cases. So we caution everyone that if you're inviting someone into your home and they don't live there, you're at risk for either spreading COVID to them or for them spreading COVID to you. And it's extremely important that during this time that you practice social distancing. And if you couple social distancing with masks or with face coverings, that has been shown to decrease the spread of COVID-19. So there have been a couple of other things that have come up with the 140 hospitalizations that we're documenting in Mobile County. The first question is, well, what kind of strain does that put on our hospital system? So the current number of ICU beds in Mobile County stands at 2,140. Now, there is some flexibility there in terms of can those be increased and can intensive care services be flex to other areas of the hospital. Our hospitals are very good at that. And in fact, as of this morning, there was still 25% additional capacity in our ICUs based on the 2,140 available hospital beds. The real question comes in terms of what is the effect on staff? So it's not the issue with the number of ICU beds, but it's the effect that these increased numbers have on the nurses and the physicians and other support staff that are taking care of the COVID-19 patients. So these individuals not only have to take care of the patients, but with the increased volume, you get into areas of fatigue. They also have to take care of their families at home, and the levels of burnout are troublesome. So earlier today, the Medical Society of Alabama and the Licensure Board did enact an emergency decree that would allow physicians from other states who are qualified to enter the state of Alabama and to take care of COVID-19 patients. Currently in Mobile County, there is not a drain on physicians, meaning it's not pronounced. There is a drain on physicians, and there's certainly a drain on nurses. But this was a preemptive act that would essentially bolster the number of physicians, and hopefully this will be extended to nurses that can come in and practice in the state of Alabama if our numbers do get worse. The other big event that occurred at the end of last week was the advisory committee meeting for the Pfizer COVID-19 vaccine and then the FDA approval. So on Thursday of last week, an advisory committee met to review the benefit and the risk associated with Pfizer's vaccine. They did indicate that in their view, the risk did not exceed the benefit, meaning that on a whole, the benefits of the vaccines do outweigh the risk. There were some questions, though, due to lack of data in the Pfizer clinical trial in terms of the younger age groups and who should be covered, as well as the use of the Pfizer vaccine in pregnant and lactating females. So later today, there will be recommendations set forth by CDC in terms of how the vaccine should be used in the estimated 330,000 pregnant or lactating women that would be eligible to receive the Pfizer vaccines. So that's yet to come. The other things that came out of the advisory committee was questions around the age in which the vaccine should be indicated. So Pfizer did include 16 and 17-year-old individuals in the study. However, there were not enough individuals in that age group to really give meaningful results. On Friday, when FDA gave the emergency use authorization, they did include individuals from 16 and above in the indication. So currently, there are no clinical trials that include individuals younger than the age of 16. And there are no plans to do that until the adult programs have been completed. Once that's completed, then the pharmaceutical companies that have this emergency use authorization are actually obligated to begin pediatric trials unless there's ethical or operational issues wherein they cannot. But we will not see any information in terms of clinical data in the use of the Pfizer or the Moderna vaccine on younger age groups for quite a while. The other thing that came up with the approval of FDA is there was concerns about the adverse events that were being seen in two healthcare workers in the United Kingdom. The United Kingdom and Canada did authorize the use of the COVID-19 vaccine by Pfizer prior to the FDA approval. So these have both been in use in the Canada and the UK for at least a week prior to the distribution today. So we will have very good data by the time the vaccine is available for the general public in basically late March or April, as long as there aren't issues with distribution and availability with those two. There was also an additional meeting on Saturday where the Advisory Committee on Immunization Practices met, and they did unanimously approve the use of COVID-19 under the FDA indications. So I also wanted to talk a little bit about the distribution of the Pfizer vaccine. So the Pfizer vaccine is being distributed globally. In the U.S., it is being sent to hospitals, and here in the state of Alabama, it is being distributed to 15 hospitals who have the ultra-low temperature storage capability required for the Pfizer vaccine. After the distribution of the 15 hospitals, and once Moderna goes through the advisory committee process on Thursday of this week, there will be additional meetings on how to use these vaccines in parallel. So hospital workers, long-term care facilities are in phase 1A. When Moderna shares their data and FDA approves it, then there will be additional recommendations in terms of the phase 1B, phase 2, and phase 3. The Moderna vaccine does not have the issues with the ultra-low temperature storage requirements that Pfizer does, but it does have some low temperature storage requirements. However, it can be distributed in a wider geographic area and has the lower tolerances that are more favorable for this distribution. So currently, Mobile County Health Department is not scheduled to receive the Pfizer vaccine this week. It will not be until after the advisory committee meeting and after the advisory committee on immunization practices meets again and further defines how the vaccines will be distributed. However, we do have capability for the ultra low temperature requirements and also have the infrastructure in place to refrigerate and freeze the Moderna vaccine. Okay. Let me see here. So following up with the vaccine questions, as the vaccine's being rolled out, we've had some additional questions with respect to some of the operational aspects and some of the potential contraindications or issues in terms of distributing the vaccine. So one question that we had was, what happens if you vaccinate someone with one of the vaccines that's asymptomatic but positive for SARS-CoV-2? So the current protocols are that you do not test these individuals. You can go ahead and give the vaccine. The way the vaccines work is they target the spike protein. And so having the natural or wild form of SARS-CoV-2 in your body when the vaccine is given does not in any way put the patient in danger for increased immune response or these cytokine storms that you've heard about. The contraindications currently for the vaccine are not to use the vaccine in combination with other vaccines because there is no data in terms of multi-use with other vaccines. I do want to be clear that as far as I know, there are no contraindications around if you carry an EpiPen and you are at risk for some of these hyperimmune responses. That is not a contraindicated condition. The current recommendations are to go ahead and administer the vaccine and then to carefully watch the patient to make sure that if they do have these hypersensitivity reactions, that they're managed appropriately. Okay. I think that was it. So I did have some Facebook questions here. So one of the questions was around whether the COVID-19 vaccine would be free. And it is at no charge from Pfizer and Moderna and all the pharmaceutical companies that participated in Operation Warp Speed or was subsidized by the government. There will be no charge for those vaccines. You may encounter what's called an administrative charge, which is simply to cover the overhead for your local GP, nursing staff, that type of thing. But there is no cost for the vaccine itself. We had another question about the increase in hospital numbers and the concern around physicians not being able to manage the caseload and individuals being sent to hospitals that are already full. This is potentially a problem because as the hospital staff become more and more overwhelmed, then it may be an issue for you to find care. When we look at all-cause mortality, which is another marker of the effect of COVID-19 on our population, all causes of mortality are up in the era of COVID-19 compared to pre-COVID-19 5-year periods. So not only is COVID-19 causing an increase in the actual viral-related issues, but it's affecting other aspects such as mental health, such as suicide, such as violence, such as heart disease. Some of that is access to care, individuals not going. Some of it will be capacity. So again, wear your mask and socially distance. It is as effective as the vaccine if you will do that in terms of stopping the spread. The last aspect here was on complaints and going into restaurants, going into local convenience stores, and people not wearing masks, although the mask placards are being hung. If you have an issue with any facility, you should email COVID-19@mchd.org You need to report the name of the institution, the time, and the matter. Please don't do it anonymously. We very seldom will respond to anonymous phone calls or anonymous tips without that documentation. But we do encourage you to report that. So finally, I wanted to address some of the other aspects that are becoming evident with the COVID-19 rollout, the vaccine rollout. So we are receiving reports from the Better Business Bureau around some scams that are occurring around COVID-19 distribution, requesting medical information, requesting your social security numbers, that type of thing. So in terms of vaccine delivery, that type of information is not requested via text or via email. That information is only collected within secure environments wherein your healthcare provider may be soliciting that on a secure website or in person when you go receive the vaccine. So be careful. Unscrupulous people will take advantage of just about any situation. So be careful about information that's being solicited around the COVID-19 vaccines. Make sure that you're giving information to only your healthcare provider or to legitimate distributors of the vaccine. So I think that is all I had today. I wanted to make sure that everyone is aware that we are gearing up for the Know Before You Go pre-Christmas or pre-end of year holidays. This Saturday, the 19th, we'll have 3 facilities that are doing COVID-19 testing. The tests do take about 15 minutes. We do anticipate to be as crowded, if not busier than we were for the pre-Thanksgiving testing. So be patient with us, please. It is free testing, and we will get you in and out as soon as possible. We did learn some things that we hope will make things go better, but bring a book or good music, that type of thing, to help the day go by faster. So with that, I'll sign off. We'll be back on Friday with our update report, and we hope you have a good week. Thank you very much.